Hi, I'm Dr. Tom Lewis, founder of Real Health Innovations. I'm a medical scientist with credentials at the Harvard School of Public Health and a degree from MIT. And the whole focus of Real Health Innovations is to help people prevent and reverse the most severe diseases we face in society today, chronic conditions. One of the overlooked areas in healthcare that is intimately linked to chronic conditions is our oral hygiene. So you can see here your mouth, your life, the connections between your oral health and your whole body health. Now, this is taken from a brilliant publication from Scientific American from well over a decade ago, and it shows the intimate connection between periodontal diseases and all parts of our body, and the common link is inflammation. I just want to point out one thing, because there's so many things on this slide, that even premature births are related to poor oral hygiene. In America, we suffer with one of the highest rates of premature birth in the developed world, tied at around 79th in the world with Somalia. And what researchers are finding is that pathogens, periodontal bacteria, find their way in the placenta and cause premature birth. So this is not just a mouth-only condition. The healthy mouth is connected to your whole body. So Scientific American over a decade ago showed us the link between inflammation and periodontal disease. Well, inflammation is considered the underpinning to so many of the chronic diseases, from pulmonary diseases to diabetes, autoimmune diseases, and even Alzheimer's. So it's a real critical issue. The health of your oral cavity is really critical. So let's look at some specific examples. So for example, diabetes and periodontal disease. Become a Google Doc and just look up this simple set of terms, and you'll see many, many research papers that show how insulin resistance, the precursor to type 2 diabetes, is impacted by inflammation, which is tied back to infection, and one infectious source in our body is periodontal infection, a very manageable but very obvious source of this infection. So osteoporosis. So many women are on bone strengthening drugs, Fosamax and all that, but they also have poor oral hygiene. Well, the pathogens in our oral cavity, what do? They chew at the gums, but they also chew at the jaw structure. They eat bones. And now when you look at the nervous system, it's connected to the rest of our body. So that oral pathogen, P. gingivalis or others, can travel to other parts in our body and find the food they like. And what food do they like? They like bone, osteoporosis. So one thing to take good note of is don't be satisfied with just average health. Be satisfied with great health. So here's good health where you have no symptoms. Here's poor health where you have constant symptoms. And somewhere in between, you have symptoms erupt occasionally. From the oral hygiene perspective, let's look at bleeding gums. So healthy people, when they floss their teeth, there's no red blood on their floss. They don't have bleeding gums, even when flossing. If you have a little bleeding of the gum, that's a bad sign. You're heading in the wrong direction. And the bleeding of the gums is due to periodontal disease. So bleeding is directly tied to your infectious burden. So this is how it works. The bacteria gets in to the vasculature and then starts working its way into the nervous tissue and the bone. So when your gums are bleeding, what's really happening is the pipes, the vessels, the capillaries in your gums break very easily. So the bacteria is literally breaking down the health of your blood vessels. And since that bacteria can travel beyond the gums, that's why there's such a strong connection between periodontal disease and cardiovascular disease. It's happening in our vessels. So how do we fight this? When you go to the dentist and the dentist scrapes that material, that plaque, what they're really doing is they're scraping away the periodontal bacteria that's forming at this gum line where we have such a beautiful environment for bacteria to live. Oxygen, food, water. So this is why you need to go to your dentist a couple times a year. And sadly, the oral hygiene products that we buy over the counter do very little to break down this plaque. That's why you wind up going to your dentist. So what do these biofilms look like? Well, if you've been to the beach and you look on the rocks and you see the barnacles, this is a metaphor for what the bacteria, the plaque, look like on our gum line in our teeth. So they are little colonies. Now, the bacteria aren't just swimming around, they live inside this biofilm. So here, the barnacle is inside this crusty formation. So that's really what we have going on. And so we have to not just you can't just remove the bacteria. You have to break down the biofilm, the housing complex that this bacteria lives in. So a couple things that really work at this that are actually very simple cures. One thing we find with our patients who brush with salt water, they have very good oral hygiene and much less plaque. And this is not a very popular toothpaste, but even Colgate talks about a salt-based toothpaste. So salt, a heavy salt environment actually kills the bacteria, so it's a very effective toothpaste. The other thing, maybe you've heard about oil pulling. So what you do is you take some coconut oil or some other vegetable fat and swish it around in your mouth for a long period of time, as much as 15 minutes, and do this as often as you can, daily if you can. Why this works is that barnacle-like biofilm is actually lipid, and lipid is fat, and oils, like coconut oil, help to slowly break down your fat, or the fat of that biofilm. Now, your saliva is actually very antibiotic, so once the biofilm is broken down by the coconut oil, the bacteria is released, and it will actually be eliminated naturally by your own saliva. So oil pulling is a very effective tool that can be used at home to prevent periodontal bacteria from proliferating.